For joining us here today at Children's Minnesota, either in person or online. My name is Marc Gorelick. I'm the president and CEO here, and I want to welcome everybody to our panel discussion here on gun violence. Appreciate the panelists who you'll meet in just a moment. I appreciate our marketing and communications team put this all together, and I appreciate all of you for participating. And with that, I will turn it over to our moderator, Kate Raddatz.
Thank you so much. And thanks to everyone joining us here today in person and online. Really such an important topic to be discussing. So we're really grateful to have you all here. I'm Kate Raddatz. I'm the Director of Communications and Public Relations for McClung PR. Very happy to be part of this discussion today. I will be moderating. First, I'm going to introduce our panelists. I will be asking questions of them. And for those of you joining online or in person here today, I will leave time at the end to make sure if you do have a question that I will be able to ask that for you. So you can put it in the chat or raise your hand here when I say that we will take some questions at the end. So let's go ahead and meet our panelists. You already heard from Dr. Marc Gorelick, Children's Minnesota President and CEO. We have Maggiy Emery, Protect Minnesota's Executive Director, and Jalila Abdul Brown, Change Starts with Community Executive Director. So I'm going to start with this question for all of you in sort of setting the landscape of where we are today, asking how has gun violence in Minnesota changed in recent years over the past decade? Are there any specific trends or patterns that stand out? And Dr. Gorelick, if we can start with you on the end over there.
So nationally, gun violence has been a problem for a long time, but it's really accelerated in the last few years. When I was starting my pediatric career 38 years ago, it was the second leading cause of death in kids. And since 2020, it has been the leading cause of death in kids. So that's certainly it's not a trend to be proud of, but it is certainly a remarkable acceleration of this incredible public health problem.
Maggiy.
Yeah, thanks, Dr. Gorelick. So as you mentioned, gun violence has risen down. Thank you. Sorry, I'm just getting the hang of this microphone. Gun violence has risen very rapidly in the past few years in Minnesota. So we are up as of this year, 42% in gun deaths from 2019. So that's a very, very rapid growth in the last handful of years. We've really seen gun violence just rocket upwards, and this is across types of gun violence. So this is community gun violence, this is firearm suicide, this is death in children, this is domestic violence. Basically every type of gun violence is up in our state in the last handful of years. And what we've seen now is that we've leveled out, right? So there were 570 gun deaths in 2021. In 2022, there were 569 gun deaths. So really no change. So we saw this very, very rapid growth that's now leveled off, but it's not going back down. One other super notable thing is that Minnesota is unique in this. Many other states are kind of seeing that that COVID growth line go back down. We're not seeing that here in Minnesota. We're seeing that we're sticking at this very high level of gun violence.
And Jalila.
And I would say over the last decade, within the last 6 years, also what we've seen, as Doctor pointed out, is a rapid growth in gun violence against youth, children, and then also women. That is not intimate partner violence. It is just community neighborhood violence. 2 years ago, we broke a record in the state of Minnesota to have the most women and girls shot in history in this state from community gun violence. So just imagine walking down the street and a bullet hits you. So I would say we are seeing a sharp rise of gun violence against youth, children, and then also women and girls that is not intimate partner violence in the state of Minnesota, and especially in the city of Minneapolis.
Since you bring up the impact on children, and Dr. Gorelick, you mentioned that statistic since 2020 that now firearms are the leading cause of death in kids. Can you talk about how is gun violence really reshaping what childhood looks like for kids living in America today, and for their parents too, with the threat of gun violence?
I think that we can look at that a few ways. Again, it's the leading cause of death in children, in part because other causes of death have come down, but also the number of deaths in children from guns has gone up. So there's that direct impact. Of course, for every child who's shot and killed, there are 5 or 6 others that are shot and survive. So nationally, there's almost 5,000 children a year who die from gun injury, and about 25,000 are injured. So there's the physical impact of that on those kids. But there's a growing body of research that shows that the community impact is really pretty substantial as well. There's a study that was done that looked at kids from 3 different communities: Boston, Philadelphia, and a rural community in Tennessee. So representative sample around the country, ethnically, demographically, et cetera. And they looked at these kids, and what they found was, first of all, of the 10 to 17-year-olds, 50% of those kids reported having witnessed or heard gunshots in their community. And over 25% of the 2 to 9-year-olds, so little kids, are hearing this. And what they're finding is that those kids who do witness, or either directly witness or hear, so indirectly witness gun violence, have much higher rates of mental distress of various kinds. So this is hugely prevalent, right? National sample, 1/3 to half of kids are exposed to this, and that increases their risk of a variety of mental health outcomes: anxiety, depression, withdrawal, et cetera. So that's just one study, one example, but it demonstrates that there's a clear mental health impact and a reaction to that. There's in many communities, kids are play deprived because they are not able to go out and play, to take advantage of what children are supposed to be doing because of the both real and perceived safety risks in their communities related to high levels of gun violence.
Maggiy, how do you shift the narrative from people looking at gun violence as just a public safety issue, a criminal justice issue, to a health issue and a health crisis?
Yeah, thanks for that. So the reality is that gun violence is a public health crisis. Violence is contagious the same way that COVID or another communicable disease you might think of as contagious. It spreads from person to person when you're surrounded by it, when you see it in your community. It's very easy to pick it up, right? And think about the amount of public health dollars that we spend on treating folks who have been shot, right? Thousands, and I mean, not thousands, like millions of dollars a year, billions of dollars over the last decade. If we don't frame this as a public health issue, we're doing a disservice to all of the people who suffer this as a incident of their health. When we talk about gun violence, yes, it has to do with public safety, but we need to treat it the same way that we would treat any other public health epidemic, which is as a disease. We need to prevent it the same way that we would prevent a disease. We need to treat it the same way that we would treat any other disease. And we need to have holistic care at every stage of the gun violence prevention process, so that it's not just, oh, scary people with guns doing bad things, because that's not the reality of what happens. There's a million things that happen before someone makes the decision to pull a trigger, just like there's a million things that happen before someone ends up intubated in a hospital. And if we can get at folks every step from A to Y before the Z happens, we can prevent so many incidents of gun violence that seem unpreventable when we think about it as a public safety issue alone.
Jalila, what have you seen in your work in terms of the health impact on not just individuals from gun violence, but on communities as a whole?
I would say within the community, you have trauma that creates cycles of violence, right? And then when you have unaddressed trauma, then you have retaliatory violence that happens in communities. With youth, we're seeing an uprise in what we call clips that youth and people are connecting to guns. So when one gun goes off in North Minneapolis, it's not one shot, it is 20 to 50 bullets. Recently, we had about 3 youth that were shot right by our program. The car was riddled with bullets, with 50 bullets, with about 5 youth, ages 10 to 12 inside of that car. I had to go to the hospital. We work in partnership with Hennepin Healthcare Next Step program. I come from that program. I came back out in the community because I buried about 20 kids that were riddled with bullets, and most of them were gunshot bullets to their heads. Those families are still impacted by losing those children. So for my youth to see those youth riddled with bullets it really impacted them. And then they begin to talk about not even wanting to go outside. So a lot of our youth in the Black and brown communities are depraved from just even nature. And I think when we think of gun violence, we just think of mass shootings. It is bigger than that. We're talking about neighborhood community gun violence that, if treated as a public health issue, because that's what it is, we could really address it. Because one gunshot wound, I looked at somebody's bill, it was $1 million to treat him. We could put that into preventative and intervention measures that would only cost hundreds of thousands versus 1 million per person that is getting shot by 3 bullets. So that lets you know the impact. And my lens is not just from the community, but it's from a hospital approach, because I was in the hospital and had to come back out because in 2020, we had so many shootings and killings that the CEO of Hennepin Healthcare, she talked to me. She said, I think you would be better off back in the community so that we can decline some of this crime. And we've had, and the youth violence in our community, because of the work that I'm doing and many other people that's in this room right now are doing, youth violence has declined by 40%. So I would say community violence intervention and prevention is what we have to look at first versus coming from behind. Because when the trauma is there, we got to stop the cycle, because if we don't, then we're dealing with retaliatory violence, which impacts even more youth, even more children, and even more families.
Jalila, a follow-up to that, because you talk about the work that you do. Can you tell people, explain what Change Starts with Community does, and talk about the work that you do in terms of helping to prevent trauma, on top of the gun violence prevention?
So Change Starts with Community is a nonprofit that was actually started because my sister was shot. My sister was shot, and they still haven't found who shot her, but her bones was broken in 1,000 places. And when I saw that, nobody came for my sister. So what I did was I said, we got to do something about this on the boots on the ground level. So I started Change Starts with Community. We have a group called Youth Group Violence Intervention, YGVI. We work with youth and their families from a mental health approach. We have community trauma programs. We just opened up the first food shelf and community resource safety center in the city of Minneapolis. Our grassroots raised $2 million within 30 days. The money was received from the city of Minneapolis, the state of Minnesota, Hennepin County, the Cargill Foundation got involved. They said, we got to do something about this. And then also Dave and Kathleen McClellan Foundation got involved. We got this money and we opened up that center. And what we do is we offer jobs on site. I believe the best violence prevention is a job. And also education. So we have mentorship on site, we have free food, free clothing, but then we also take the youth on exposure trips. I think a lot of our Black and brown youth are not exposed to colleges that are right here in Minnesota. And a lot of them feel like they can't even get into those colleges. So we just took them to the University of Minnesota the day before Thanksgiving. We have right now 25 youth. They make $18 an hour. So it's livable wage jobs. And who first started paying for their jobs is the Cargill Foundation. They saw an uptick of violence within the community. And if corporations and hospitals feel like they're not, they should not be at the forefront of this movement, you are mistaken. Safety impacts all of us. We can't even have sometimes good grocery stores in North Minneapolis because of safety. We just had about 3 stores close in North Minneapolis within the last year. So it is a food desert. It is a resource deprived desert, but we are making up the difference. We are located at Shiloh Temple, and the church also has to be a reflection of the community that it serves. And if the church and any faith-based organization think that they're not a part of this, they are mistaken. So we had to get back on the front lines. We partner with a lot of our other community organizations, such as Touch Outreach, Agape, Don't Shoot Guns, Shoot Hoops, who are in here right now, Metro Youth Diversion. We all partner together to build safe communities because it's an ecosystem. We cannot do it alone. So it may be some resources I have that they need, and it's resources that they have that I need. So we look at it as an ecosystem, but within the last 3 years, we have a 0% recidivism rate. I'm going to say that again, a 0% recidivism rate, that none of the youth that we get that come to our program go back in the streets. We have youth from Hennepin County Probation. I had one youth that stole 50 cars that was 12 years old. This is what we're dealing with. I've never seen youth so young that pick up guns. This is what we're dealing with, but we exchange with them a job and food and resources that you need, that you don't have to go back in the street and try to be an adult as a kid, because really your family is deprived of the basic necessities, right? That is what's going on in Black and brown communities. And if all of us think that we can't do something, we are all mistaken, right? It takes all of us to prevent violence. And just like Maggiy said, gun violence is a disease that can be cured.
Thank you. Dr. Gorelick, can you share some of the health outcomes that have been observed in states or countries where stricter gun laws have been enacted or were already in place?
Yeah, so I think, picking up on this idea of, gun violence as a public health issue, that means that we have to recognize that there are multiple factors. All public health things are not one thing. So it is about the gun and the bullet. It is about the individual and the factors that influence their behavior. It's about the social environment. And similarly, the approach to public health problems has to be multifactorial. So it involves education, it involves community activities, and it involves policies, right? So you're asking about the policy part of it. And making comparisons across countries and across states even can be challenging because there's so many other factors that can confound that relationship. But certainly the evidence would show that there's a very strong correlation between stricter gun laws in a jurisdiction and lower rates of gun injury. When you take into account other factors like the fact that places with stricter gun laws tend to have fewer guns, that gets a bit less so. So there is still a correlation. It is not as strong. So the evidence would suggest that gun laws, and that includes things like safe storage practices, that includes things like enhanced, the background checks, red flag laws, and so on, things that are designed to both restrict access of guns to individuals who might be more likely to use them in a way that harms somebody and or makes them less lethal, that it does have at least a moderate reduction in gun injury. And when you look at something that causes as many deaths and injuries as it does, even a modest reduction would be a substantial positive impact to the health of our society.
Maggiy, can you talk about what recent legislation in Minnesota specifically has been introduced or enacted to address gun violence and what impact it has had so far?
Yeah, so we've been really lucky in that we've had a couple successful years at the legislature. So in 2023, we passed a package of gun violence prevention legislation that has been really impactful in reducing gun violence in Minnesota and will continue to be so. So we passed extremist protection orders or red flag laws, which are a mechanism to get a gun out of the hand of someone who is actively a threat to hurt themselves or others. In other states, we've seen that these laws are impactful in reducing firearm suicides by 11 to 14%. Here in Minnesota, 71% of our gun deaths are firearm suicides. If we can save 11% of those lives next year, that's like, I don't know, doing the math real quick, that's like 30 to 40 people. That's not an insubstantial number of lives saved just through one piece of legislation. We passed background checks, universal background checks on all gun sales. So previously, before this law passed, it was only if you were buying a gun from a federally licensed firearms dealer that you had to perform a background check. There's not that many reasons in the state of Minnesota or federally where why you would be barred from owning a gun. If you are barred from owning a gun, it's because you have some violence, some criminal violence in your past, and it's probably not good for you to have access to a gun. So now all gun sales, the internet, private sales to friend, are all covered under this law. So a background check needs to be performed before I can sell my gun. I don't own a gun, but if I wanted to sell my gun to anybody in this room, I'd have to do a background check on you first to make sure that you don't have any violence in your past that would preclude you from being able to own that gun. The other piece that I'm really excited about is that working with a lot of amazing folks in this room, we were able to pass a $71 million in support for community violence intervention, which Jalila has talked about, and is a really impactful, effective, evidence-based strategy, public safety strategy to prevent and reduce violence of all kinds, and especially penetrative injury, gunshots, and stabbings. Last year, we were able to pass a law that made straw purchasing a felony in our state, and included in that law was a ban on dual switches. So what a dual switch is when you pull a trigger, that gun should only fire one time. A dual switch turns it into basically a submachine gun where you pull the trigger and then release the trigger, it fires again. So 2 shots for every 1 time you pull the trigger. So those are now illegal in the state of Minnesota. So we've had some success. It's been really exciting, and I think all of these things are going to be impactful in community in reducing gun violence. But obviously, knowing what levels gun violence are at in our state, we have a lot more work to do at the legislature and on the ground.
Thank you. Jalila, can you talk about what types of partnerships are most effective in tackling gun violence prevention on a community level?
On a community level, it takes government has to be involved, laws have to be written, policies have to be changed, and then you have to have community involved. I always say you can't make a decision without us, about us. Community has to be at the table. Those impacted most by the violence and the closest to the violence most of the time have the better solutions to solving that violence. So if we're not involved with making the policies, decisions, the laws, we have to be at the table with the governor. We have to be invited to the table with the mayor of Minneapolis and different cities. We have to be invited to the table with Hennepin County and their commissioners so that they can hear from us what we're seeing in our communities, because we are the experts of our community. And that goes beyond race, that goes beyond those that are in these communities doing this work. And unfortunately, when we look at reality, is those that are impacted most by violence are the ones from Black and Brown communities. And there's just no getting around that. Even when we look at intimate partner violence, you have more Native American women and African American women more impacted by that. So the biggest thing that has to happen is to tap into the wealth of knowledge that is in our communities. And I would say working with Maggiy and Dr. Marc and Children's Hospital, they have the Next Step program in this hospital, right, which is community-based. Which is hospital based, but still community led. And so we have to have those different programs so that we, even in our hospitals, know how to have trauma-informed care, right? And that states it's not about what's wrong with you, but it's about what happened to you. And when we look at this from that lens, then community gets pulled into hospitals. Community also gets pulled into public policies to help change laws that impact us.
Dr. Gorelick, excuse me, can you talk about how does gun violence strain public services such as healthcare systems, particularly in emergency and trauma care?
Yeah, I mean, on the sort of the micro level, and one of my emergency medicine colleagues is here. You know, when a gunshot victim comes into the emergency department, everything else stops. There's a team of about 17 people that surround that person to first and foremost try to save that person's life. So, you know, when that happens on a regular basis, as it does in our emergency department and other emergency departments around town, that's at a very micro level, just makes the system run less well. It also has an impact on those people. You know, when I tell people, you know, I'm a pediatric emergency physician, I practiced for 25 years, and they say, oh, that must be really tough, but I guess you get used to it. Wrong. You do not get used to it. You learn how to deal with it in the moment, but you never get used to it. And I don't think there's a single time I've taken care of a child who was seriously injured, you know, by a gunshot where I haven't at some time after we were done meeting their needs, sat down and cried. So it has a real impact on the staff. On the system level, I think Maggiy alluded to this. You know, there was an estimate from Everytown for Gun Safety a year or so ago that nationally we spend over $550 billion a year dealing with gun injury. $550 billion a year. That includes direct medical costs. That includes lost productivity from missed school, missed work, et cetera. That includes the criminal justice and law enforcement, and it includes huge impact due to the loss of quality of life. You could argue that maybe that quality of life estimate is inflated. If it's 1/10 of that, it's still multiple billions of dollars a year that we are spending on this instead of so many other things that we could be spending to improve public health. So I think it has both a direct impact on everybody who takes care of those patients in the moment, and it has a huge impact on our healthcare system.
Jalila, can you talk about and you've touched on this, but some of the long-term, psychological effects on survivors and witnesses of gun violence and how these will impact their quality of life going forward?
We talk about, and I'm so glad Dr. Marc touched on this, vicarious trauma, right? And the secondary trauma that a lot of people in our communities will continue to deal with from gun violence. We talk about when you take a bullet to your body, you also take it to your brain. The emotional wound behind a gunshot. Like I said, me watching my sister shot, I can still see her blood to this day. I watched a little girl named Anaya Allen take her last breath. I also spent $30,000 burying her. I watched D. Hill take his last breath. A lot of the young people that died, I watched them take their last breath. I was there in the stay room with them. We also have to help doctors. I don't think people realize this behind the scenes. We have to help the doctors operate to save their lives. Most doctors are not mental health professionals. They are trained to save a life, and they are trained to do medicine, but not mental health. And so when you get back in our communities, the emotional wounds from that runs deep. So in our communities, you'll see the balloons and the bears on the trees. I've had somebody ride with me in North Minneapolis, like, why is there so many bears and balloons on trees around here? I'm like, oh, that's where somebody got killed. So they was like, so you mean to tell me every single tree around here, somebody got killed? I'm like, just about. That's what you're looking at. You're looking at that community memorial for that person. And sometimes they still gather 3 and 4 years later to celebrate that person's life. So the social determinants of health that it has, which on impact the community, sometimes fathers are killed. That father was the breadwinner, right? So now how is this family in this community going to eat? So then they may resolve to more violence. I like to say that violence begets violence, and hurt people hurt people. So if we don't in the community help them stop the bleed, then our communities continue to bleed. But I tell you this, it takes money to do this work. And we're talking about billions of dollars. I just told you one victim could be $1 million or more. Why not invest that back into the communities so that we can get ahead of this, so that that individual who picked up a gun doesn't go hurt somebody, that we can be the ones to stop them from killing that person or harming them or harming someone else. That's the kind of work we do. A lot of us, I got a call in this room, somebody, they told me that they were out doing their work and somebody pulled out a gun on one of their staff. That is real vicarious trauma. That is a lot of trauma. So what we have to do is address the mental health piece with a lot of the community people who are doing this work, but then a lot of the youth, the families, the adults, the men and women we see, so that we can create safe, healthy, and hopeful communities up front.
If I could just want to pick up on that, because I think just to add to that, I think another piece that we sometimes forget. So, the people who are doing the shooting are also affected, and their families. There's an organization in town called Art is My Weapon. It's run by an artist named Nikki McComb. Tries to use art as a way of promoting healing and preventing violence. And she did an exhibit last year called Full Circle, which really talked about the impact that gun violence has on the victims of gun violence, the people who care for victims of gun violence, which I talked about, and the perpetrators of gun violence. And that's another dimension. And that's a potential avenue, because I think, I had the opportunity to talk recently with Melvin Carter Jr., who over in St. Paul has an organization called Save Our Sons. His goal is to try to help youth understand that consequence to them, right? That, even if you don't think you're going to get arrested, even if you don't think you're going to have a criminal justice penalty, it's going to take a toll on you by having those who have been in that situation, working with them to educate them about the very real impact it has. So, I mean, it really is a full circle. I mean, the impact of this is just dramatic on the entire community, everybody in the community.
Maggie, suicide is a devastating piece of this conversation when you talk about gun violence. Can you talk about, and I know Dr. Gorelick said, all of this, there are multiple pieces to this, right? But can you talk about what is being done, maybe from the policy side, or what is being done to prevent suicides from happening when we talk about gun violence in Minnesota?
Yeah, absolutely. So suicide is very similar to community gun violence and very different in many ways, but it's similar in that there are so many factors that lead up to it before someone gets their hand on a gun and pulls the trigger aimed at themselves, right? So we have many, many chances to intervene before someone makes the decision to take their own life. So in terms of policy, we talked about red flag laws a little bit. There's also a lot of pieces that can be done at the community level. One thing that we're working on at Protect Minnesota right now is a gun storage mapping project. So in our pilot counties, we're working, we've actually now launched our gun storage maps, which show all of the facilities within that county that will agree to accept a voluntary transfer of your firearm. We have no laws in the state of Minnesota that says that any law enforcement agency or federally licensed firearm dealer has to accept a gun. But if you are experiencing suicidal ideation, if someone that you care about is experiencing suicidal ideation and you want to get that firearm out of the home before it gets to the point of a red flag or an ERPO being filed, we've created these maps. We're hoping to take them statewide. That will show you where in my county can I access somewhere to safely store this gun. Clinician counseling, right? So many of you, hopefully, we're in a hospital. Hopefully you've all seen a physician for a wellness check in the last year. And during that wellness check, you'll get a depression screening usually, right? So this is like that. This is a physician checking in to see, do you have firearms in the home? And are those firearms safely stored? And if the answer to that is yes and no, the clinician is trained to give you a training as your trusted healthcare provider. How do you safely store your firearms when they're in the home? The other piece of that is that in our pilot counties, we've equipped these physicians with these gun storage maps. So if they're hearing, yes, I have guns in the home, no, they're not safely stored, or yes, I have guns in the home and I'm pinging on my depression screening, I'm not doing well, the physician can hand you a map and say, I recommend as your health provider that you get your guns out of your home. Here are facilities are close to you that will take these firearms. The gunshot project. So this is something that's been implemented in other states with varying degrees of success. It's not all that uncommon that someone will purchase a firearm with the intention to use it against themselves within the next 24 to 48 hours. What the gunshot project is it's simply when you go to purchase that gun, you get suicide prevention materials at the point of purchase handed to you by, again, that trusted validator of your local gun shop owner. Somebody who is not trying to, push a political agenda, not that this is a political issue, but sometimes it's perceived that way. Just somebody, and if you don't need the materials, great. But if you're in that key moment of crisis where we have an opportunity to intervene before you make the decision to pull the trigger, those materials are available for you. Again, at the point of purchase, they come with the firearm. One more thing that I'll talk about when it comes to suicide prevention is lethal means access, right? So it really is this question of when someone is in a moment of crisis, how fast can they get their hands on a gun? What we know is that firearms are the only method of suicide attempt that is successful, meaning that it ends up in a death over 90% of the time. The next most successful method of suicide is strangulation or hanging, and that's successful in only about 30% of cases. So even if someone is really feeling intense suicidality, if we can keep them away from a gun, chances are they will not complete that act of suicide. The other piece that we know is that over 90% of the time, someone who attempts suicide and survives does not go on to die by suicide. So if we can save them the first time, very often in the vast majority of cases, we are saving them in the long term. Really one big key here, safe storage. It just gives someone multiple chances to stop, make a different decision about completing a suicide. So, the best guidance is to store your firearm in a biometric safe that can only be opened by the permitted gun owner, unloaded with ammunition stored and locked separately. That gives you so many steps for, you know, a grandkid to call and say, Grandpa, I can't wait for you to come to my birthday party this weekend. For a dog to come back in from outside and for you to remember, oh, I have this dog who needs me. Very often suicidality really is a crisis moment, and it's not a long-term thing, which is not the narrative that we often see, but that's the truth of the matter. And if we can get to someone at that decision point and give them an opportunity to turn back, we are often getting them over the bump of that crisis and getting them to a state where they can come back to a little bit more rationality and seek out the resources that they need for help.
Dr. Gorelick, how do you see the role of healthcare providers into, you know, emergency room physicians, nurses, you know, what role do they play in identifying risk factors and intervening in cases of potential gun violence?
I think there's a couple of roles. One is, in fact, in identifying those risks. So, you know, patients who come in through our emergency department, they get depression screening or suicide screening to look for those risk factors. And certainly every point of entry into the healthcare system is a way to try to screen for those risk factors. It's also a really important point of educational material and in sometimes actual physical material. So, you know, again, asking, I mean, every one of us who's ever been to a healthcare facility probably gets asked, do you feel safe at home? Okay. How about being asked, do you have a gun at home? How do you store your gun at home, et cetera? So including that as part of routine screening. And then here's some information on how to store these things safely. The information Maggiy pointed out, we give out gun locks and gun safes when asked. So I think there's a role both in identifying people at risk and also in intervening through education and providing the equipment that they need to help make sure that if they have a gun, that it is stored safely, and also normalizing the question. Nobody thinks it's weird if you ask somebody if they have a medication allergy. And frankly, if you take your kid to somebody's house, nobody thinks it's weird to ask, you know, if your kid's allergic to pets, you ask, is there a cat at home? Why is it weird to ask if there's a gun at home? It's just as much of a risk as the cat you might be allergic to. So I think healthcare providers can help normalize these conversations. It's a health issue. This is a health risk factor, just like all the other ones we talk about.
And I want to come back to you because I want to ask about, you recently wrote a book on gun violence prevention. Can you tell us a little bit about that and why you wrote it?
Yes, here it is. It's called Saving Our Kids. Again, 2020, we learned that in 2020, guns became the leading cause of death in kids. And we learned this, you know, a couple of years later when the data came out. And everybody started talking about this public health crisis of gun violence. And I was glad that we were talking about it as a public health crisis. And I was frustrated that we weren't acting like it's a public health crisis. Here we were coming off the biggest public health crisis of the last century, the COVID pandemic. And we acted like that was a public health crisis. We knew what to do. We did things, and our response to COVID wasn't perfect, but we saved a lot of lives by the way we came together as a country because we identified that it's a multifaceted issue. It's not just a single thing. It's, again, multiple factors, as I talked about. You need multiple approaches to it. That's how we dealt with it. Why weren't we doing this with gun violence? Because it's just as much of a public health crisis. And so, you know, really the motivation behind the book was to say, what would it look like if we actually treated this like the public health crisis it is, if we did the things that we have been talking about, and to try to spur particularly my colleagues in the healthcare community to say, yeah, that's what we ought to be doing. And to do some of those things that they can do, some of the things we talked about that healthcare providers have within their own power to do, and to use our voices as healthcare professionals to advocate for these things that we know. So that was the motivation.
Jalila, you know, it's hard to have this conversation without also talking about mental health, right? And what role have you seen community organizations, or in the work you do, or other community organizations have in helping to address the mental health issue as well out in the community?
I would say the mental health piece is really, really huge. Because as I just stated, when you take a bullet to your body, you also take it to your brain. So that us getting ahead of that emotional toll and helping even the perpetrators right through that process and those steps of what they could do going forward to not perpetrate again. And then you got youth. How do we help them go through those cycles of emotional state to know that your frustration is temporary, right? That a lot of crisis that we experience is temporary. And if I can help you walk through those tangible differences, then we can make an impact and help save somebody's life. So on site, what we do is we have mental health check-ins. We have a doctor of therapy on site. I'm actually a mental health professional. My degree is in psychology, and I did that because of the work that I was doing. I was seeing a lot of people just in a emotional distress. And I'm like, okay, let me get a degree in psychology because I'm gonna need to really, really help some African-American people in our community. It's been a stigma to get and seek out mental health support. I had someone come in there with me on site yesterday, and he was thinking about killing somebody. He said, I saw that this is a resource safety center, so it made me walk in. He sat down with me, we talked, I listened to him, and when he left different than the way he came, right? And so me walking him through that what you're feeling right now is temporary. You don't have to go out and actually kill somebody just because you're feeling like that temporarily. Then I told him, think about your kids. Think about your family, how they're going to feel if you're behind bars. And then are they even going to come visit you? He was like, you know what? They really not. So we got to walk people through those processes. So we do offer free mental health check-ins for our youth. And then we, with our doctor of therapy that's on site, we accept different forms of medical so that we can also help them with mental health. A piece that I saw that was missing was the Hennepin County, a lot of the human services that they offer. So what we began to do, we had a meeting with Hennepin County. We said, hey, we want the kiosk that you guys have in your own facilities on site. Well, they said, well, we don't offer that in the community. They got to come to Hennepin County to get it. And I said, well, that's doing a disservice to our community. So we began to talk with them even more. I didn't let it go. I wouldn't let it go. I wouldn't let it go. So we have a kiosk that is coming into our location. We'll be the first location outside of Hennepin County to have a Hennepin County Human Services kiosk that people can apply for medical on site. They can apply for food support on site. They can apply to vote on site. A lot of the different social things that Hennepin County offers, they'll be able to get it on site with us now. We actually needed that. It was a big piece because if you do want mental health, and let's say we weren't there to offer for free, most doctors are not going to sit down, especially with the Black and brown community, for free, right? They're going to need some type of medical because guess what? The doctors got to get paid too. I understand it's still business. So with that, that's going to give a lot of people access to healthcare benefits that will also pay for those mental health support that a lot of people in our community needs. And I would love to see it even more with a lot of boots on the ground people that is doing this work. I believe that with the Medicare bill getting passed, and Maggie will touch on that more, that's going to be a piece of that we can offer free trauma support and mental health to our team members as well, because we're out here doing the work. And to watch 150 people die, that's a lot of people that I watched die within 1 year, right? So of course I needed mental health. The helper needed help. So if I didn't have medical, I wouldn't have been able to take full advantage of that. So I would say in our communities, in order for us to get the mental health support we need, we first got to offer the access to medical benefits. I like to say that Minnesota is resource rich, but access poor. It's a lot of resources in this state, but if you go to a lot of different communities within South Minneapolis that is Black and brown, 38th in Chicago, the Phillips neighborhood, Midtown neighborhood, North Minneapolis, the entire North Minneapolis, you're gonna see that access that they got in Southwest changes. The access that Edina has, it changes. So Minnesota has to stop being resource rich and access poor and make that more available to Black and brown communities, just like what Dr. Marc said, make it more normal where you can walk down the street and like you said, you got a cat in the house. Oh, can I apply for medical over there? With don't shoot guns, shoot hoops. Can I apply with medical, with touch outreach? That's a real thing. And we got to make this, the access to what we need more common in our communities.
Dr. Gorelick, we talk about the state of youth mental health today in 2024, almost 2025. And, how does that impact where we are at with the gun violence crisis? And if you only focused on addressing mental health, youth mental health, would that solve the gun violence issue?
I mean, certainly youth mental health has been a huge issue. It's been increasing incidence of all kinds of mental health disorders among kids, anxiety, depression, for quite a long time. It accelerated in the last 4 or 5 years. That said, so if we look at kids in particular, about 60% of those deaths are community homicide, and about a third are suicide. Most people who shoot other people are not homicidal maniacs. They don't have mental health problems. And conversely, most people with mental health problems are not violent. So it's a relatively minor factor in those deaths. And for the suicides, to reiterate what Maggie said, very often the first sign of a mental health problem of serious depression in a kid is the fact that they attempt suicide. If they try it with a gun, it will work and they will die. If they try it with something else, they won't. So clearly we need more support for mental health in kids. There's no doubt about it that that's a societal good. It's unlikely that by itself that's going to make a huge impact on this problem of gun violence.
Maggie, can you talk about what is next in terms of legislative priorities for gun violence prevention in Minnesota?
Yeah, so I'll start off with talking a little bit about the Medicaid bill that Jalila mentioned. So we talked about these CVI, the community violence intervention services, right? These really crucial public safety services that right now are funded through the state if you're lucky, through the city or the county if you're lucky, through private foundations if you're really lucky. These dollars are really hard to access and they're inconsistent. So one thing that we'll be working on is a reimbursement through Medicaid or public health systems for these services, so that when you do a counseling appointment with someone, that's not coming out of the pocket of the organization. That's billable to Medicaid, to our public health services. So they're paying for it at the front end instead of paying at the back end when someone gets shot and has to go to the hospital. This is preventative spending that will be impactful in our community, so that when you're out on the street and you do a mediation in a conflict before it erupts into violence of some kind, that's billable to Medicaid, right? All of these pieces that are really important street and CVI workers are doing that currently, they front the funding for somehow if you can get dollars, if you're lucky, because we don't have a good support system for this really important public safety work right now. That should be funded through public health dollars. So Medicaid reimbursement for those services is going to be a really big priority for us this year. A couple other pieces, safe storage, right? So we've talked about safe storage. Right now, in Minnesota, you don't have to safely store your gun. There's no reason that you would need to do that. There's no law around it. And not only is this access to firearms, really impactful in the case of suicides, in the case of community gun violence, in the case of youth gun violence. One thing we haven't talked about all that much is mass shootings, and that's because it doesn't happen that much here in Minnesota. But we know that when a child gets a gun and discharges it on campus, either in a mass shooting or just in an interpersonal conflict, 80% of the time they get that gun at home. Kids can't buy guns in this state. So if they're getting their hands on a gun, they're getting it from somebody in the home who owns a gun and isn't storing it securely. So what this law would do is simply say that, hey, if you have a gun at home, you got to keep it locked up, which seems objectively reasonable. Another piece for us is going to be an Office of Gun Violence Prevention at the state level. Right now, we're losing almost 600 people a year to gun violence in Minnesota, and we don't have anybody in the state government that's in charge of curtailing that. We don't have a ton of coordination around our efforts to end that. We don't have coordination between the people who collect the data and the people who do the grant funding and the people who do the mental health care. All of these services are siloed, even though to really prevent gun violence, we need a holistic approach. So what we're going to ask for is a Office of Gun Violence Prevention that takes all these pieces and says, okay, what are the funding streams? What's the data? What are the services? And how can we get this all under one roof so that we're looking at this as a all-around holistic issue, not just a little piece here, a little piece there, bite off the apple here, bite off the apple there. So those are going to be three big pieces for us. And one more thing that I will just highlight is lost and stolen firearm reporting. So just a requirement that when your gun is stolen or goes missing, you report that to law enforcement within 48 hours. We know that these guns move between stolen guns move between state lines with incredible frequency. It's estimated that like 500,000 to 600,000 guns are stolen in the U.S. every year. Like this is a way that kids, violent people, folks who shouldn't have their hands on guns for whatever reason are able to get their hands on guns. So making sure that law enforcement and the ATF knows to track when your firearm goes missing. Those are going to be some big ones for us this year.
I think at this time I can see if anyone has questions, whether you are attending virtually or here in person. Here in person, you can feel free just to raise your hand and we can, yeah, we have someone right over here.
So with the recent legislative wins, wondering about the sort of historical unwillingness by law enforcement for red flag or stronger. We had a recent example here, city of a neighborhood, a known neighborhood person that escalated to violence that could have been stopped well beforehand. Or we have a gun store in Robbinsdale selling strong purchase guns that end up a mile away at 36. So where is the
I'll repeat the question for people joining online, but the question, if I can briefly summarize, was with the recent legislation when it comes to gun violence prevention, what has reaction and enforcement been like among law enforcement in Minnesota? Maggie, maybe you can weigh in on that.
Yeah, so a couple things to that. So one is that I feel that this is where an Office of Gun Violence Prevention will come in especially handy because we don't have incredible coordination right now around ensuring that the gun laws that we pass are actually enforced. The Department of Public Safety is doing the best job that they can with a lot on their plate, but we really need somebody who can take a look at this and say, where is this getting enforced? Where is this not getting enforced? What are our mechanisms to make sure that it is getting enforced going forward? So that's piece number one. And then I would say, piece number two is that this is a tough nut to crack. We've had some really great partnership from some law enforcement agencies and some not great partnership from other law enforcement agencies. And we're happy to lean in where law enforcement is willing and able. And we try to be supportive in the case where law enforcement wants to be helpful, but doesn't understand what this is or how to enact it within their own department. And some of it does stem from just misunderstanding. We've had a lot of laws passed in the last 2 years, and it can be hard to understand, what's my job as the person who has to enforce it. So try to, provide training and support as helpful and be open to the conversation. We do have sanctuary counties in Minnesota, law enforcement, who have said that they will not enforce any firearm laws. And that's not something that we can control, but we can do our best to be supportive to folks who are open to working with us, provide the resources to folks who need more resources, and just continue to have the cultural shift conversation that makes gun violence not a divisive political issue, but the public health issue that it is.
Thank you. There's a question online asking, how do we make these initiatives bipartisan? And I think any of you could answer that question if anyone wants to jump in, or Maggie, that's fine. Dr. Gorelick, if you want to start.
Yeah, it's such an important question. And sometimes when I talk about this, people say, well, you're getting political. And my response is generally, well, one of the necessary parts of a public health response is policies. So that's political. But how can we be political without being partisan? And I think some of it has to do how we talk about these things. For a long time, alcohol and drug abuse was seen as a moral or a criminal justice issue, right? And we now see it as a disease, right? This is not a moral failing. This is not a criminal issue. This is a disease. And when we do that, you start to see the conversation change. We're talking about a disease, which doesn't have to be as partisan. So I do think honing in on the fact that this is a health issue, that gun injury is a disease, an injury, and keeping the focus on that. I think we've succeeded with other things like alcohol and drug use. Those of you old enough to remember the AIDS epidemic back in the 80s, that started out as sort of always a lifestyle thing, and it became very partisan. No, it's an epidemic, and we dealt with it. So I do think that's a key, is this framing as public health is an important part of it.
Yeah, thank you, Dr. Gorelick. And just to expand on that a little bit, I think the narrative piece here is really important. We've seen bipartisan movement on this issue in the past few years. We had the Bipartisan Act for Safer Communities. The straw purchasing bill last year passed with bipartisan support. It's an issue of framing. Right now, the way we frame gun violence is that it's either mass shootings or gang violence, right? And to a lot of our legislators, that's something that happens somewhere else to someone else. It's not my problem. So we as community members and as advocates need to do a better job of explaining to our elected leaders that, like, hey, this isn't something that happens to someone else. This happens in my community. This happens to your constituents, whether you're right here in Minneapolis or in greater Minnesota. Actually, the Senate district with the highest amount of deaths from gun violence is in St. Louis County. So this is a statewide problem. This is something that impacts everyone, and and we have to frame it like that, both as advocates, and we have to frame it that way as people who are in charge of telling the story, right? So as media, as folks who report on this, like, we need to frame this both as a public health issue and as something that impacts every single one of us, no matter what community you're from. We saw those bills passed in reaction to Bipartisan Act for Safer Communities passed in response to the Uvalde shooting, and the straw purchasing bill passed here in Minnesota in response to the Burnsville shooting that killed members of the law enforcement community. So it can't just, and law enforcement and children should never be killed by gun violence, but it can't just be we react when law enforcement and children get killed. We need to do a better job of talking about how this is not just kids and law enforcement. Not that those things are okay, but this is my cousin, this is your sister, this is your child. These are people who matter and they exist, and we need to advocate around that to our policymakers. Until they see that this is their problem too, they're not going to take bipartisan action on it.
And I think also with the new presidency coming in, we really have to frame it as not just being us against you approach, a Democrat against Republican approach. It has to be bipartisan. And the reason why, we just had a healthcare executive that was killed by gun violence. He actually gave me an award about like last year for the work that I do in the community with gun violence, not knowing a year later he'd be dead from gun violence, right? So that's a real thing that impacted me like hugely. I mean, he spoke so well of me, highly of what we were doing, because he said this is a public health issue. He's dead now, right? Running $1 billion company. So this is not just happening in the hood. This is happening in the woods. So it has to be framed like that, so that a lot of laws that you just heard that have been passed is not rolled back, right? Even Washington, they have an Office of Gun Violence Prevention that is at risk right now when our new president takes the helm of being erased. A lot of he's promised a lot of laws that Biden has passed for gun laws that have been effective. He's promising to roll a lot of those back. So if we don't want those rolled back, how do we get not just our president coming in, but the people working with him and under him in different states to see that this is not just happening to someone in our just local urban core, it's actually happening in our suburban core, and that this can touch anyone, just like someone going into a meeting was killed, right? This could happen to anyone. And so those laws that have been passed need to stay in place, and more need to be passed so that we protect our youth that are coming up, so that they're able to go, as Dr. Marc said, on the playground and play, so that our kids can grow up in a society that is saying, man, we made some smart, sensible gun law policies that now my little kids and my granddaughter, us who's gonna remember this COVID era, we can say, man, isn't it nice they can just go outside and play without having to worry about a bullet crossing over their head, or without having to worry about a clip going off, that they're just actually free to be kids again as we were. And that is what I dream of, that a lot of us sitting in this room can work ourselves out of a job.
Maggie, oh, right here. Go ahead. There's a question if all youth is treated the same if with insurance if they are a victim of gun violence. With or without insurance. Thank you. If youth are treated the same with or without insurance, if they are a victim of gun violence.
Medical services, preventive services, all those things are available to everybody here, regardless of ability to pay. That's something we're very committed to and very proud of.
Annually, yeah.
So the question was about how much this costs per year. It's the estimate is about $550 billion a year, which is about $1.5 billion a day. That's everybody across the country. So that's taking care of the people, the lost work, lost school, et cetera, the criminal justice costs and the policing costs, and then the loss of quality of life, the quantifying what that means when you are suffering depression, when you can't go outside because you're scared. When they've quantified that, it adds up to over $500 billion a year.
Because it is a $1 trillion industry when it comes to gun that sells the gun, right? Everybody's making money off something, right?
Yeah.
And it comes down to money and power.
Yeah. So the question, if I can repeat the question, is, given how much money is involved in this, is there an incentive to actually try to fix the problem? The actual money that goes to, say, people providing care and stuff is a very small part of that. And I don't know what it's like at other hospitals. I can tell you that we lose money on taking care of patients who are victims of violence. So if I were totally just being selfish, I'd say, yes, I want this to go away. But the bigger picture is, this is a cost that is borne by society. This is because when somebody is shot, they can't go to work. This is because when somebody is shot, they can't function the way they normally do. And that just takes money out of our system. It doesn't add any money to it. So I think, if we were smart as a country, we would look at this and say, my God, this is costing so much for nothing. That I think there should be every incentive in the world to try to make this go away.
And can I tag one thing onto that, which Tommy, you mentioned, which is just that the industry does have an incentive for gun violence to continue. Every gun that's sold is another dollar in the pockets of the manufacturer. And we have laws in this country that give them immunity, right? Almost no other industry has laws that protect them from being liable for the things that their products that they advertise to children and women and all kinds of people do, right? So for some systems, like hospital systems, our public health systems, like, yes, it makes a lot of sense for this problem to go away. For the industry that manufactures and sells these guns, they don't want this problem to go away, and that's why they spend so much time and money lobbying to make sure that it doesn't go away. So it's not just a question, the whole narrative that we have around gun violence, it's not just been innocently shaped. It's come from billions of dollars of spending by this massive industry that doesn't want to lose a single sale.
I want it right here, and then I'll make sure I ask all of you one last question as well. Go ahead.
So when we talk about Office of Violence Prevention at the state level, do we have anything in place at the local level with the hospitals and clinics?
There's a question about the Office of Violence Prevention at the state level. She's asking if there's anything more locally at offices and clinics.
So we do have on the municipal level here in Hennepin County and Minneapolis, we have offices. We have the Office of Neighborhood Safety, Office of Community Safety, and there's what is it called at Hennepin County? What's the name of the program? Safe Communities. They also have an Office of Neighborhood Safety in the city of St. Paul. So we do have these on a municipal level. They're not funded and supported in the way that they always need to be in order to be totally effective at upholding the work that organizations like Jalila's do, which is why we need more support and coordination on a state level.
So the coordination between the hospital and community, there's no space for that?
Is there any coordination between hospitals and communities?
So I would say the first program that we had that does gap all that together, that's located inside the hospital, is the Next Step program. So the Next Step program is located here at Children's Hospital. They're located at Hennepin Healthcare and North Memorial, right? So those are, and Abbott. Yep. So those are most of our trauma hospitals within this community right here. The good thing about the Next Step program, which is led by Kentrell Galloway, is that they coordinate with us out in the community. So I helped restart the Next Step program because they wanted at one time to get rid of it. So I was brought in along with Kentrell Galloway to help reshape that program and what it looks like. And we actually built it back up. So the Next Step program is an excellent program. And what it does is it meets victims, and we a lot of times meet the perpetrators of violence right there where we are. I mean, we've had to break up family fights. We've had to actually diffuse people who actually killed the person on the inside, on the outside. I don't think people realize that when it comes to the hospital, a lot of even the security that goes into that, we had to move. The morgue moved out of Hennepin County. We had a big incident where people ran in there on us. The person was already dead and they still wanted to kill everybody in there, right? So we had to diffuse that. It was only a team of like 10 of us. But because we had connections to the community and we knew the people that were coming up there, they stood down. But if we were not there in that hospital, I can't tell you what would have happened to Hennepin Healthcare. So I don't think people see the behind the scenes of the trauma that we deal with when it comes to diffusing people, even from the hospital level. So we try to ask the police and community not to put on the news and the media, which also plays a huge part. They also make money off these deaths. Nobody wants to see little Sally riding her bike, right? They also profit off of what's bad and what's not the good news. So we don't even include media in that, but they're also a part of the problem. But we try to get them not to even pose where the patient is staying, because that poses a risk for the doctors who are trying to save their life, the nurses, the anesthesiologist team, and a team like Next Step that is working behind the scenes to help save that person's life. So Next Step actually helps to stabilize people who are shot in the hospital. The only thing that Next Step, what they've done lately is partner with community. Here's the reason why. I found out that when people are healed, they don't come back, right? So a lot of people who get healed from the hospital, it's not like they're checking back in. Oh, let me come back and check back in with Next Step. They're not. So that is where community organizations come in at. So we have a partnership with Next Step that we have a community trauma group on a weekly and monthly basis. And we see at each of those groups about 150 or more people that come from the hospital out into the community who do not want to go back into the hospital, right? So we got to catch these people where they are, because when they are treated, I like to look at it as the Band-Aid effect. When you get a sore and you put you have a wound and you put a Band-Aid on it, once it's healed, you're not putting a Band-Aid back on, right? Because you feel like it's healed. But it could be something else going on internally. And that is where the community organizations come in at to reach beyond the hospital so that it becomes that ecosystem, right? Because the hospital can't do it all and it costs too much money for them to even try to do it all. So I would say that the Next Step program is an effective program that is located right here at this hospital that is doing a phenomenal job within the hospital systems to have that CBI up front.
And just to put a pin in that and to brag on Next Step a little bit more, folks who obtain a penetrative injury, stabbing or shooting, have an almost 70%. Once they've received one, they have an almost 70% chance of receiving another. Folks who go through the Next Step program and work with community partners have a 0% recidivism rate. So they do not come to the hospital, back to the hospital. Are they're at 3% now?
3%, which is still very low.
Which is still really good. Yep.
I'll ask one last question of all of you to give your closing thoughts, this topic today, gun violence prevention, and also people who are here, who are watching, what they can do now to get involved. And perhaps if it's in relation to the work particularly you do, would be great as well. Jalila, actually, I'll start with you.
I would say that supporting community organizations like Change Stars of Community and different organizations that I mentioned that are in this room, like right now, Touch Outreach, A Mother's Love, Don't Shoot Guns, Shoot Hoops, Agape, Metro Youth Diversion, a Next Step program. It is so many of us that are out here doing this work. You got 21 Days of Peace. You have the Violence Interrupters. You have that hospital. You have GVI, which is Group Violence Intervention. You have Youth Group Violence Intervention. And then you have a YCC program. It's so many ways that you could get connected. And I also want to challenge the philanthropic organizations. I want to challenge you to get involved, because honestly, if the Cargill Foundation and the CEO, the former CEO of Cargill, didn't get involved with me, I don't know where we would be right now. The Minneapolis Foundation had to actually stand up behind us because government moves slow. And a lot of times trying to get those government dollars is like fighting cats and dogs. So we also need non-government organizations such as the Target Foundation. I'm calling them out to get behind us, the Polad Foundation, even more to get behind us, the Bush Foundation, to get behind this work so that we can really see safe communities, so that in North Minneapolis, we can get a Whole Foods over there. We could get another pharmacy over there. We don't even have pharmacies in North Minneapolis. When I look around me, all I see is greasy and fiery foods. And then we wonder why we have the underlying health conditions that we have. A lot of times I've seen sometimes it was the bullet that just killed somebody. It was the bullet mixed in with the underlying health conditions. So just really get involved with us, seeing how you can organize and volunteer with us, because a lot of times we can't pay everybody that wants to help us. We would love your volunteering hands. We have a food shelf that we would love people to get involved with. Our youth, we would love people to get involved with and find out what we're doing, and don't try to come in trying to control what we're doing, but come in to actually see what we're doing and how you actually can help without taking over our organizations. These boots on the ground organizations are necessary. They're needed. And I like to say, when it comes to law enforcement, it's not us and them, it's them and us. It's a and or approach when it comes to the hospital. It's a and or approach when it comes to politics. And whether you believe it or not, this work is political. It is extremely political. And once we see this new regime get in office, you're going to see how political, just how political this is. So I would tell the government to get involved with us. I would also admonish us as far as the ecosystem to strengthen it and to come together even more with government, with hospital CEOs and execs, so that we all know who each other are and we're working at the table. So if Dr. Marc has an issue and he has a youth in here that's getting out, he could call one of us in this room and say, hey, I don't think this youth will be safe, but I'm better off putting them in your hands. Are you able to help them, so that I know that this youth will remain safe, alive, and free? So I'm admonish you guys to get involved with us. You can go to the City of Minneapolis Neighborhood Safety website, who Lawana Nelson Brown is the director. You can go to the Office of Community Safety website with the City of Minneapolis. You can go to Safe Communities with Hennepin County. They have all of our organizations listed. I cannot say the same for the state of Minnesota. So that is why we got to get coordinated from the state level down. But Hennepin County and the City of Minneapolis has been doing a phenomenal job with capturing community violence intervention up front. They are only one piece of this puzzle, but the state of Minnesota, I am calling them out to get on board and to create that Office of Gun Violence, so that we can have a coordinated effect from the state down, because I'm telling you, we cannot move policies unless they're written from the state down. So I am challenging everybody in this room, because it takes all of us to prevent violence, to get involved with us and see what we do, but also learn what we do.
Thank you. Maggie.
Yeah. So I work for Protect Minnesota, which is the state-based, statewide gun violence prevention organization. So I have the distinct pleasure of coordinating with a lot of groups in this room to try and be helpful in getting resources from the state, city, municipal level onto the ground, and working on a statewide level to try and get resources to every part of Minnesota where gun violence is happening, which is in every corner of our state. So we know that gun violence is very complicated, and there's not one policy, there's not one pool of funding, there's not one thing that we can do that's going to stop every single incidence of gun violence. But we can save one life. We can save one life tomorrow. We can save one life passing a policy. Every life that we save is worth saving. I'm a survivor of gun violence, and I've seen the impact that it had on my family. And I can tell you directly that no one should have to go through that, and that all of these deaths are preventable. So to that end, I would echo everything Jalila said. Gifts of your time and your dollars are obviously hugely impactful, especially for these on-the-ground organizations that come from community and don't have the benefit of a ton of resources, right? Philanthropic dollars are not available. Government dollars move very slow. Please do what you can for organizations like theirs, like ours. And the other thing I would say is, we just need bodies, right? We need our policymakers to understand that this is a majority issue. Right now, they feel like they don't have to take action on it because no one's going to call them out for it if they don't. And the more people who get involved, the more people who show up to an event like this, who show up to a rally at the Capitol, who show up to, I know that Touch Outreach and Change Starts with Community both hosted really great events this last summer. Show up to those events, be present, show people who are on the ground that you care about them, show policymakers that this issue matters and that you're not going to be quiet. And we as a community of Minnesotans are not going to be quiet until action has been taken and our beloved community members have been saved from this epidemic.
Thank you. And Dr. Gorelick.
Everything that was shared is fantastic. I think the one thing I would add is I do think the best way for us to really start to make progress on this is to shift the conversation, to shift the framing, to move it from being a partisan issue, from being a criminal justice issue, to being a public health issue. And so my plea is help us do that, right? Talk about it that way. Don't be afraid to talk about it. I mean, this seems like such a huge, intractable problem. But remember how we all felt in April of 2020, right? That seemed like the world was ending. And it didn't, right? COVID came and we dealt with it. Again, thinking back to other public health crises we've dealt with, it starts with thinking of it as a public health crisis. So don't be afraid to talk about it. Don't shy away from it, and help people understand that these are real people who are being hurt, physically hurt, emotionally hurt, financially hurt by this disease, by this illness of gun injury. And let's work together to shift that framing so that we can start to actually work collectively, collaboratively, and in a bipartisan way to make progress on it.
I want to thank all of our panelists today, Dr. Marc Gorelick, Maggiy Emery, and Jalila Abdul Brown. If today's topic interested you, please do get involved in this issue. Follow these organizations, Children's Minnesota, Protect Minnesota, and Change Starts with Community. And thank you so much for being here today or attending online. Have a great day, everyone.